great job in flattening the curve when we came at home under extraordinary circumstances with stay-at-home orders and significant sectors of our economy closed down. And as we go through the reopening process, it is natural that we will see an increase in spread. What we want to avoid is exponential growth. We want to avoid significant increases. And the way that we do that, while understanding that as more people go out, there is higher risk and there will be an increase in spread, but the way that we maintain or contain that in a manageable way is each and every one of us choosing to do everything we possibly can to do our part to slow the spread. That is things like face covering. That is physically distancing from non-household members, washing your hands, adhering to temperature checks. And as we move through this, we want to continue as a region, ensure that we can continue forward progress. You're seeing concerning instances happening in states all over the country and in other counties. And while we are clearly seeing an uptick, both in cases and percentage of positive and outbreaks, we want to try to level that off, and we want to try to manage and contain that growth. And so today, we are imploring the public to please be mindful of the orders that are put in place. They are only put in place out of a desire to protect life and to protect our economic recovery, and each and every one of us need to do everything that we can to ensure we are being as careful and safe as possible. The operating assumption was if we came together and we stayed home, we could flatten the curve. That did give us time to increase our ventilator capacity, to increase our surge capacity in our healthcare systems, to increase our testing, our contact tracing, to give us the tools we need. And now we're in a situation where every single day we will collectively fight the spread of coronavirus. Not to stop the spread, but to slow the spread to manageable amounts. And in that fight, we need every single San Diegan to be a part of that fight and to have a mindset and mentality that every day we will go about our life doing everything we possibly can to try and slow that spread, to protect the integrity of our healthcare system, to protect one another, and to protect our reopening. And so as we move forward, we continue to ask for everyone's help and cooperation with what we're doing. Let's jump into our numbers for today. Today we are reporting our testing 6,981 tests conducted today. We are crouching up on the 300,000 mark for the totality of what we're doing. You will see our 7-day average there at over 7,000. Again, slightly inflated because of some of the batching, but we are doing very well and surpassing our initial daily goal of 5,200. Our contact tracers, again, 478, above our initial goal of 450. Those contact tracers are vital to identifying individuals, identifying close contacts, tracing back where they go. We're naturally going to see an increase in outbreaks as we have more contact tracers, as we have more testing, as we have more insight into what's happening out there on a daily basis. But this is also a vital tool to early identify problem areas, take corrective action, early identify positive cases, track their close contacts, and get the appropriate folks tested as quickly as possible. And then, of course, our treatment rooms remain available for anyone who cannot isolate safely at home. Today, as I mentioned earlier, we are reporting our single highest day total, but again, it's in the context of testing. 332 positive tests reported today out of the 6,981. This is a 5% percentage of positive. Our rolling 14-day average is 3.1%. So we are over that. We are in line with it yesterday. The preceding 2 days we were over it. Obviously, that purple line you see there is ticking up, and we would like to get that back in a little bit more flat direction. Hospitalizations have a modest increase today. You see an increase of 2 in ICUs, increase of a little bit more than that in non-ICU. These are COVID related. Again, so we're now at 370. Again, not higher than where we were a month ago, but a slight uptick over the last couple days. Total hospital system capacity, you can see we're still below that 4,000 mark when you take COVID and non-COVID hospitalizations, and then well below the 80% bed capacity. Of course, hospitalizations are a little bit of a lagging indicator, and so we will watch this metric very closely in the coming days and weeks. And then our last one here is our ICU utilization. Again, a very modest uptick in COVID ICUs, slight uptick in non-COVID. Again, ICU bed capacity still at 64%, and you can see the dotted line there representing the percentage of ICU, which holds relatively stable. It's trended up, trended down, but again, holding relatively stable. That concludes my section of the report. Now I'll turn it over to Dr. Wooten for her Public Health Officer's update.
Thank you so much, Supervisor Fletcher, and welcome everyone to today's briefing. Global, national, and statewide statistics are based on data that we retrieve from the Johns Hopkins dashboard obtained today at noon. Globally, there have been almost 9.3 million positive cases, including over 478,000 deaths. Nationwide, the United States is reporting almost 2.4 million positive cases, now at 25% of the global number, and includes almost 122,000 deaths. Statewide, California is reporting almost 192,000 positive cases, which is 2% of the global number, and includes 5,629 deaths. And today, the County of San Diego is reporting 11,626 cases, which is 332 more cases than yesterday, one of our highest daily number of cases yet. And this number includes 347 deaths, which is 6 new deaths reported since yesterday. The age range remains unchanged, 3 months to 102 years of age. For the age group 20 to 49 years of age, this is 54% of the total number of cases. Yesterday, our COVID-19 watch was also issued, and it also includes graphics that show cases by age group. So you will see that in that particular document, the largest number of cases are seen in the 30 to 39 year old age group. For gender, 51% are female, 49% are male. 1,661, or 14% of cases, have been hospitalized. Of that number, 456 have been admitted to the ICU, and this is 4% of the total number of cases and 20% of the total number of those hospitalized. As of June 23rd, yesterday, the county has surge capacity for hospitalization at 34%, and for ICU admissions at 36%. Regarding race and ethnicity of all cases, we have data for 82%, or 9,586 cases. Of this total, 66% are Hispanic or Latino, 21% are white, 6% are Asian, 4% are Black or African American, and 94, or approximately 1%, are of multiple races. 1% is or includes Native Hawaiians and Pacific Islanders, and 14, or 0.1%, are American Indian or Alaskan Natives. Of the total number, we have 347 deaths, which represents 3% of the total number of cases. Of this number, 43% are female, 57% are male. 328, or 95% of the total number of cases, do have underlying medical conditions. Regarding race and ethnicity of all deaths, we have data for 99% of the total number, 344 out of 347. Of this total, 148, or 43%, are Hispanic or Latino, 145, or 42%, are white, 41, or 12%, are Asian, 10, or 3%, are Black or African American, and 1, or 0.3%, is Native Hawaiian or Pacific Islander. And as always, our sincerest condolences and sympathies go out to the families of those that have lost their lives in the new cases today, as well as all cases that have succumbed to COVID-19. The next series of slides show data related to tests, cases, hospitalizations, ICU admissions, deaths, and outbreaks. And we're going to start with cases, and we will push tests to the end so that that aligns with our triggers. And this particular slide, you see, as I stated earlier, that yesterday was the single highest number of cases in one day, 352 rather. So We will continue to look at the trend, and when we talk about comparison, if you look at the last 5 days and compare that to the preceding 5 days, the percentage change still is above the percentage that is identified for our triggers. And again, the caveat there is if you have irregularity or inconsistent in testing, that particular trigger will be abnormal. So we recognize that and hope that over the next 5 days, we will have more consistent numbers in the range of what has occurred over the past 2 days. But we'll see that when we talk about tests. Next slide. This is hospitalizations and new hospitalizations. And as you will see, yesterday also showed 22 new hospitalizations, which is slightly higher than most days in the prior 14 days from this. The only other highest number is June 11th at 30 cases. Next slide shows ICU cases. And we have seen over the past 3 days that ICU cases have declined since June 20th. Next slide is related to deaths. And as always over the weekends, the 20th and the 21st were weekends, so we usually don't see many deaths on the weekends. Our vital records department is closed, so not unusual that we would see an increase in the number of deaths on Tuesdays, and we'll see it will be pretty much consistent with the prior weeks. Next slide. And this next slide is related to tests. Now, before we get into testing, actually, I'll have the slide if you go to the county shield. Since the beginning of COVID-19 pandemic, the COVID-19 pandemic in San Diego County, there have been 125 outbreaks in congregate settings and community settings. And to provide context of the 125 outbreaks, 65 or 52% are now closed or defined as inactive outbreaks, meaning that there have been no new cases in that facility for the past 14 days or longer. Of the remaining 60 active outbreaks, these include 19 or 22% are in our San Diego skilled nursing facilities, and there are 86 of those in San Diego County. We had one new outbreak reported since yesterday in this group, and we also have 22 of the 60 active outbreaks seen in non-skilled nursing facility congregate settings. In this category, there is also one outbreak reported since yesterday. And lastly, there are 19 of the 60 active outbreaks that are in community setting locations. We have had no new confirmed outbreaks reported since yesterday. We have had one outbreak that has become inactive. Now, the next few slides will update us on the county's 13 triggers, and that's where we want to start with testing. Where I was speaking before of the last, if you look at the last 5 days on this slide and compare it to the prior 5 days, that percentage change is elevated, and we'll see that number on the trigger slide coming up, but just hold here. So this is the daily number of overall tests performed, not the new cases, but just the overall number of deaths performed. For the last 2 days, we've been consistently above 6,000, actually above almost 6,800, which is where we want to be. So we are anticipating that if we continue with these types of numbers over the next 5 days, the number one trigger in our triggers will normalize, and that will be great news. But we know that it is abnormal now because of the irregularity in testing. In the next slide This speaks to, again, trigger number 2, which is related to outbreaks. So for June 16th, 3 outbreaks dropped off and joined the ranks of the last week on the right side of the slide and the histograms that are in green. And as of today, we have these 8 confirmed outbreaks that are seen throughout the county. And these vary. There are some, most of them are businesses. There are some that there might be one a restaurant, as well as a campground and other businesses that have been identified throughout the county. In the next slide, this is our epi curve. So I'm going to spend a variation of this slide. We have 3 more, just to kind of give some context to what has been going on with the reopening. So between April 20th and May 8th, we had been looking at that as kind of a peaked area, but with the reopening, we see that we continue to see an increase in the number of cases, and that is to be expected with opening up and people gathering. Next slide. We wanted to show the May 21st was the date where we had our restaurants reopen, and just showing what happened in the 14 days after that, but knowing that that particular incident or reopening could have an impact over the entire following days and weeks. But again, this is just to provide some overall context in terms of the increase. And we know that these increased number of cases are not absolutely due to this particular incident. But again, just trying to show what things look like. Next slide shows May 27th, which is when churches of worship began to open. And the next slide is related to our first protest in San Diego. And keep in mind, again, all of these incidents could potentially influence new cases going forward for days, months, weeks, and months. So we just wanted to show what that could potentially look like. And then under the curve here, we expect that new cases will continue to occur under that box to the extreme right because of the 14-day incubation period. And then the next slide is now just a summary of all of the triggers. I've explained number 1 as well as number 2. And I'd like to point out that for trigger number 11, our target there is to be greater than 90%, and we're at 98%. And for contact tracing, our target is about 80, was cited as 80%, but we are at 91% as well. So much improvement has occurred, particularly with trigger number 12, as we have brought on more contact tracers. I think that is my last slide. I just want to point out again that while this does not mean when we see the various outbreaks that we will hit the brakes and come to a full stop. It does not mean that at all. But it does mean that we will continue to use common sense and conduct routine best practices, conduct the infection control and prevention assessments of the various outbreak locations, and conduct appropriate case investigation and contact tracing so that we can pull individuals that are infected or have been exposed to confirmed cases so they cannot potentially infect others. And following the primary best practices to prevent the spread of COVID-19, this still remains very important. And I just want to reemphasize again that these strategies include implementing good hand hygiene and sanitation, social distancing, wearing face coverings when you, especially when you are within 6 feet of individuals, and for businesses and work sites to screen for temperature, symptoms, and exposures. And of course, people should stay at home if they are sick. So these non-pharmaceutical interventions are proven, evidence-based strategies to protect the public's health. We know the actions are our best strategies to control the spread of COVID-19 as the virus remains persistent throughout our community. Now more than ever, it is vital that we take precautions to guide our personal and collective health, taking these measures to heart and adhering to them. Now please welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten, and let's go directly to the questions.
Artie Ojeda with NBC7, please state your question.
Good afternoon, everybody. I have received a tip from several sources about a potential outbreak at as many as 5 casinos. Is there a current investigation involving casinos, and what specific details can you provide? And I have a follow-up, please.
Okay, let me ask Dr. McDonald to respond.
Well, thank you for that question. And as you heard from Dr. Wooten, we have no new community outbreaks that have been detected in San Diego. And when you're talking about cases with casinos, because they're on tribal land, they're somewhat unique in the sense that they are multi-jurisdictional investigations, because the casinos and the tribes have their own sovereignty and their own investigation capabilities. That's very similar to the military. In fact, we deal with the military, and we've dealt with the tribes to do joint investigations many times over the years. So any case that involves a patron or a staff member at one of the casinos, we have a mechanism to work with the Indian Health Services and with the tribes themselves to gather as much information as possible to determine the close contacts and the nature of those cases. I can say that we are working with several tribes on several just specific cases to get more information in a joint manner. And at this time, there is no outbreak.
Okay, you kind of touched on it. Well, okay, couple of thoughts. Okay, if it's not an outbreak, what exactly are you investigating? And if there is, in fact, an eventual confirmed outbreak at one or more of the casinos, what specific action will you take, can you take, given that sovereign authority you talked about? Because it's not people just on the sovereign land, it's people from all over the county. And Dr. McDonald, you know, at this point, right now, what would you say to someone planning to go to a casino? Is it a good idea?
Wow, if you could do one question at a time, it's just easier for me to keep up with you, okay? So the first issue is that any specific case that involves another jurisdiction, we work with that jurisdiction, whether it's Mexico, whether it's Orange County, whether it's another state, and we each have pieces of the pie that we need to put together to do an analysis. So when I say we're working with the tribes on cases and specific staff members or specific patrons, we're doing what is a normal investigative process. So again, we share information, and if it is determined that there are links between either the staff or patron cases that would constitute us jointly analyzing them as outbreaks, well, then we will announce that. So that would be the process. And then your second question, I think, had to do with what would we advise? And I think we would advise anybody going to any entertainment facility to do the same thing, whether it's on or off tribal land, which is they should be aware that it is not essential to be going to do that, but many people do need that kind of entertainment and recreational relief, frankly. And so if they are going to do that, they should not be in a at-risk group, because if you're at risk, you should stay home. And they should do the same things that we are recommending to anybody going out for any activity outside their home, which is to maintain social distancing, wear a mask, and to wash their hands. And again, any business, whether it's on tribal land or off, you should be looking at what's going on around you. And if the people around you aren't doing the things to potentially protect your health, well, then you should do something about it. Talk to the management, leave, or go somewhere else. But the good news is that each of the business entities within the county, including the tribal nations, have specific plans and are addressing this with specific activities to reduce the risk.
You know, you've articulated everything so well, but can we just go full circle on this? Can you tell me specifically what's going on with the tribes right now?
What's going on with the tribes right now is that we are having active joint investigations on individual cases. Again, that's not surprising, given the number of cases that have been announced, the increased cases that have been occurred in the last couple of weeks. Also, frankly, over time, we would expect to find cases now and going into the future, both on their jurisdiction, on the military jurisdictions, outside the county, in Mexico. So again, I think you need to put it in context. And again, this is a joint investigation, which is perhaps why it's a little different than some of the other things that we've announced. But again, we have normal processes for that.
Thank you.
Okay, let's go to the next question.
Alexis Rivas with NBC7, please state your question.
Hi, yeah, this question's for Supervisor Cox. You know, you asked the state for guidance on expediting the reopening in this county, and now it seems like we're hearing efforts from the county to sort of slow that down. I mean, how do you reconcile the two? Doesn't that send a mixed message?
No, I don't think so. Yesterday at the board meeting, Supervisor Desmond or Vice Chair Desmond made a motion to ask the governor, send a letter to the governor to ask for guidance. That was approved by a majority of the board. And I think what we're asking for is, like we've done with other businesses, we wanted them to be prepared when it's appropriate to have them reopen. Now, we put a halt on new openings, but it doesn't mean those businesses that aren't open now shouldn't be prepared at some point in the future to reopen. So I don't think there's an inconsistency there at all. We're not saying that we're going to reopen anything else beyond what we have so far until we have a better handle on what's going on right now. But certainly those places that aren't open at this point should be prepared and be making anticipation of at some point in the future having the opportunity to open up when the circumstances dictate it. Okay? Next question.
Paul Sisson with the San Diego Union Tribune, please state your question.
Thank you. On Monday, I asked whether the contact tracing effort has identified any cross-cutting exposure types as they interview hundreds of new cases coming in every day. And on Monday, it was said, we're not quite sure yet, we'll get back to you. I haven't heard anything, so I'm asking again, do we have any kind of cross-cutting themes as the contact tracing is occurring and you're asking people where they've been, et cetera?
Okay, Dr. McDonald is going to respond.
Yeah, thanks for that question, Paul. Again, we don't really have any cross-cutting themes at this time, except to say that the number of people who endorse a lot of out-of-the-house activity is going up. So what it's doing for us is that it's generating a lot more potential places for us to investigate. We do some cross-matching of what people's activities have been, and when there are a lot of people doing a lot of activities going to places with high volume, we would expect to find some commonalities, but there is no consistent commonality other than people are going out more, which again is to be expected with the reopening. So not at this time, again, not for any specific business or any specific sector, but we are trying to follow that closely.
I guess guess, though, the public would wonder, if they're going out more, where are they going? What are those places? Are we talking protests? Are we talking restaurants? Or is it just all over the map?
I think that's a great question. We are certainly finding more individuals, particularly those who are younger, who are actually going to restaurants and to bars and those types of entertainment venues. We do see that people are reporting going to houses of worship, but again, there is no real specific trend. The only one that I would mention is one that we did mention, I think, on Monday, which is that of the community outbreaks that we do have several that are resident-based, that is private resident-based. And those do have a common theme in the sense that people who wanted to get together with friends after a period of not being able to do so are having gatherings of maybe 10, 20, 25 people, and they're eating and they're drinking and they're not maintaining social distance. And so I'm actually concerned about that type of activity as much, frankly, as anything out in the commercial sector. In fact, in the commercial sector, because the businesses have specific plans and have employees who are trained to reduce risk for COVID, I think that that those are safe, particularly when you have a good plan in place. But when you do something impromptu and let your guard down a little bit around your friends, maybe you're doing things a little bit closer than you might otherwise think. And I think that's the big message for today, frankly, is don't let your guard down. I mean, we need to do those three things: hand washing, face covering, and social distancing, even at a time when you're getting together with friends you haven't been with for a while. So don't let your guard down.
That's very similar to what the governor said earlier today in his press conference, and he even went so far as to say to the counties, look, we have $2.5 billion in Kerrs funding that we're doling out to you guys, and if you guys aren't doing what you can to enforce mask usage and hand washing and social distancing, if counties aren't enforcing these things, we can hold back some of their Kerrs money. I wonder if San Diego County, might change their enforcement strategies as a result of what the governor said today.
Well, I think we're well aware of what the governor has said, and I think we're doing everything we can to encourage people to do the things that would preclude the spread of COVID-19. Washing hands, wearing face coverings, keeping social distance. Again, we have to rely on the public to work with us. Some people are more cooperative than others, but we still have work to do to convince people that this is still a real serious issue that has to be dealt with. Okay,
but to be clear, you could literally cite people, right? I mean, you could go further in enforcement than law enforcement currently is.
We certainly could, but I think we'd rather work to just bring about compliance through cooperation and encouragement of people and social pressure at this point.
Thank you.
Okay, thanks. That completes our call-in questions. I think we have a couple of text questions. The first one is going to be dealing with actions on the part of a couple of states in regards to travelers over the 4th of July weekend. And Supervisor Fletcher will respond.
Thank you, Chairman Cox. This question was asked by several news agencies, so we can probably handle them all at once. New York, New Jersey, and Connecticut imposed a 14-day mandatory quarantine for travelers coming from states with rising cases. 4th of July is coming up. San Diego will see a lot of people from out of town coming to celebrate Independence Day. Could there be similar orders put in place here in San Diego County? This question is from Mike McKinnon at KUSI.
Thank you, KUSI, for that question. I would share with you that New York, New Jersey, and Connecticut are states, state governments with governors. And so the question about if our state might do that would probably best be directed to our state government or the governor.
Thank you. This next question has to do with, I think we touched on it the last question, a little bit about enforcement. The governor has said that counties could potentially lose funding to address this pandemic if they aren't enforcing the rules like the facial coverings in public. What does that mean for us here? Law enforcement agencies, will they be required to up their enforcement efforts?
Well, I think I would direct you back to the governor for greater clarification on exactly what he meant by that. But I think what you've seen in California is a number of counties that have been very clear that they would not require face coverings. You've seen additional counties that initially required them and then rolled back that requirement. Here in San Diego, we were one of the early counties to do mandatory face coverings, and every day that's gone by has validated the wisdom of that decision as a growing body of evidence supports to the foundational role face coverings play in slowing the spread. And so my sense is it's a little more directed at counties that have been very reluctant to put that in place. But when it comes to enforcement, the only mechanism that there are for enforcement, particularly as it relates to face coverings, is via law enforcement. We'd have to refer you to them.
Thank you, Supervisor Fletcher.
This next question is dealing with our thresholds, and I'm going to ask Dr. Wooten to respond.
Yes, this one is from Cassia from Fox 5. Is there concern we are getting close to having to roll back any progress with the news today of record cases in a single day? And also, she was also wondering if we were going to be able to restrict anything further for the 4th of July as well.
Thank you for the question. We have stated over the past week, as we are seeing increased number of community outbreaks, that we would not open up any new industries, but we're not looking at rolling anything back at this point in time. With the outbreaks that are identified, we work with those specific industries, whether it is a restaurant or a work site business, and there are many types of businesses out there, and most of the outbreaks are located in businesses. And as Dr. McDonald stated, we have had concern over several private residences. So again, we will work with those entities to, number one, implement infection control and prevention measures. Our role or interest is not to shut anyone down or to roll anything back. We want to try to strike a balance between implementing sound public health strategies and promoting economic viability. So again, with specific outbreaks, we will work with those entities. With restaurants, they may need to be shut down for several days so that they can assess what their infection control situation is by the Department of Environmental Health, and then they would subsequently reopen if various measures are found that need to be addressed. Thank you.
All right, thank you, Dr. Wooten.
That completes the questions for today, and I guess if there's one message today we want to get across, it's the fact that we're in this fight for the long haul, that we're dealing with a virus that is very contagious, that we don't fully understand. We're still learning a lot about it. And just yesterday, we hit the 100-day mark of operations of our County Emergency Operations Center. That makes COVID-19 the longest running emergency activation in the county's history. Now, let me tell you, that's not something we're particularly proud about or something we want to celebrate. But it shows us the reality that we're facing. Folks, this is a new normal for now. This whole COVID-19, I think, has demonstrated that the more that things open up, the more that people get out, the more this virus will spread if we're not careful. But we can end this cycle, and that means having to wear facial coverings, maintaining social distancing, washing your hands, using sanitizer. I know you're all tired of hearing this, but this is a marathon and not a sprint. But if we keep taking one step at a time, we can certainly get to the finish line, hopefully sooner rather than later. We will not be holding a media briefing tomorrow or Friday, but updates will be provided by our communications office. And of course, you can go online anytime to check the latest data information on our COVID website at covidvirus-sd.com. Until then, stay safe, San Diego, and protect yourself at all times. Thank you.